Assuming the left side, the left ventricle does not work well, what is going to happen? It's going to affect the left atrium, which supplies it with blood. And if the left atrium, the pressure in the left atrium is also affected, then it's going to back up into the lung, which is supplying the left atrium with oxygenated blood. In other words, what is the name we give to a patient who has bilateral renal artery stenosis, who then develops pulmonary edema as a result of the bilateral renal artery stenosis? A, Eaton-Lambert syndrome. B, Pickering syndrome. C, Korn syndrome. D, Kochubo syndrome. And E, Eisenmenger syndrome. What's the correct answer? The correct answer is B, Pickering syndrome. So, but one thing I want you to know is, for your board exam, please learn what Eaton-Lambert syndrome is, learn what Korn syndrome is, learn what Takotsubo syndrome is, and learn what Eisenmenger syndrome is. But the correct answer is B, Pickering syndrome, right? Pickering syndrome basically is you have a patient who has bilateral renal artery stenosis, and then that patient develops recurrent flash pulmonary edema. That's Pickering syndrome. Which trigger can cause pulmonary edema even if the patient has mild or no chronic heart disease? Which trigger can cause pulmonary edema even if the patient has mild or no chronic heart disease? A, hypertensive emergency. B, mild anemia. C, controlled asthma. D, iron deficiency. And E, hypothyroidism. What's the correct answer? So hypertensive crisis alone can generate enough afterload to cause edema despite normal ejection fraction. So just think about a gun, right? Predisposing factors are the fact that the gun is loaded with a bullet. Precipitating factors are the fact that someone picks the gun and actually shoots the gun. That is the difference.